So sickle cell disease is like you said, a chronic disorder of the blood. It is characterized by very severe debilitating pain, essentially, anemia, which is lifelong, and in the long run, sort of chronic organ damage and reduction in life expectancy. So it's quite a debilitating chronic condition of the blood.
And what have the people speaking to you as part of this research told you about their experiences of the care they receive in the capital?
So overall, we've had an overwhelming, staggering response to this survey. So essentially this research was about surveying people's experience, both their lived experience with sickle cell disease as well as the care experience they've had, because quite a lot of the time people with sickle cell disease have to go to hospital to receive health care. And what they found, what most people have said, well, 2 out of 3 people have said that doctors and nurses, healthcare professionals aren't providing enough information for these people, for the young people, children and adults, you know, to their places at work or to school, just explaining what this condition means and how it can affect their lives. 90% of people think that general awareness of this condition is lacking among you know, the community as a whole. So there really seems to be a big knowledge gap of this condition, which, as you said in your introduction, is the commonest significant genetic disorder in this country.
What impact is that having on people living with this condition?
Sickle cell disease, you know, although we would like to think that we've made huge progress in the treatment of this condition, it is still a lifelong disease. There's virtually very, very few ways in which we can cure this condition. So it can have a huge impact on patients, not just of their everyday life because there's significant debilitating pain, but also their ability to, you know, get on with life and get on with their jobs or their, you know, school life and so on. So it can affect in many, many ways, partly because of the pain, partly because of the damage it can cause to organs.
How does the situation when it comes to patient care here in London compare to elsewhere?
So we in London have, certainly from what we've learned from this particular survey, which was conducted for the whole country, we've certainly been doing better in terms of how we are, not just as specialists, know about this condition, but also in sort of more wider healthcare providers, such as in the emergency department. But having said that, there is still that lack of knowledge, and more importantly, about empathy and care. So about, you know, 40% of people have said that A&E departments in London itself are not sympathising, are not empathising with the fact that they're in severe pain. Of course, this, in comparison to the rest of the country, is better, but there's still a lot of work we need to do.